Hello, I'm Warren Hall, the National Manager of Support Services for the American Liver Foundation. I want to welcome you to this episode of our Liver Chat series, where we engage medical experts for brief discussions on timely topics related to liver disease, health, and wellness. In this episode, we're going to focus on liver cancer. The month of October is most notably set aside for breast cancer awareness, but it's also a time that we focus on liver cancer. So to discuss this topic with us, I'm joined today by Dr. Tamar Taddei. Dr. Taddei is an associate professor of medicine in the section of digestive diseases at Yale University and staff hepatologist at the VA Connecticut healthcare system in West Haven. She directs the liver cancer program at VA Connecticut and runs a regional tumor board serving Southern New England's VA medical centers. The doctor is associate director of the MD PhD program at Yale School of Medicine and is a board certified gastroenterologist with a certificate of added qualification in transplant hepatology. Now, on a personal note, related to ALF, Dr. Taddei is co-chair of the American Liver Foundation National Medical Associates Committee, and she's a member of the Liver Cancer Conference Planning Committee. So hello, Dr. Taddei. We're honored to have you with us today for our Liver Chat series.
Hi, Warren. Thanks so much for inviting me. It's a pleasure to be here.
Great. Okay, so we might as well jump right into this. My first question for you is important, I think, because the hope with this Liver Chat series is to swap out disinformation and to get rid of misinformation and then replace it by the good information. So the common belief is that once you're diagnosed with a cancer of an organ, and so for our purpose today, once somebody receives the diagnosis of liver cancer, the belief is that there's nothing that can be done. What do you say about that belief?
So that is entirely misinformation. Liver cancer is curable when caught early. And I personally have had the privilege of caring for patients with liver cancer for many, many years. And even when detected at later stages, there are multiple options to prolong life. And that's prolongation of life with maintaining excellent quality of life, because that's very important. So I think it's, the options in liver cancer are many, depending upon the stage of diagnosis. And people shouldn't sort of hear that and think, okay, that's it, it's curtains, because it isn't. There's much that we can do to both consider curative therapy and palliative life prolonging therapy.
Great. Yeah. On our helpline at ALF, we'll usually get from caregivers or loved ones, and that's the concern. Is there anything? We believe there's nothing can be done, and so I kind of knew the answer to that question, but I'm glad that you filled it in a little bit more for us. So now that we've clarified that piece, let's back up and discuss early on who would be at risk for liver cancer. And what are some of the signs of its presence?
That's a great question. I think it's important to understand risk, especially, personal risk. So anyone with the diagnosis of cirrhosis from any cause, so cirrhosis is the final common pathway of liver inflammation and scarring that usually happens over decades in response to a number of different problems that can arise in the liver. So everyone with cirrhosis is at risk for liver cancer. And anyone with chronic hepatitis B is potentially at risk. And it really depends on the demographics and the time when they were infected with hepatitis B, but that's chronic hepatitis B. They are at risk for liver cancer. And it's important to know that the liver is the largest solid organ in the human body. So most liver cancer is actually completely asymptomatic, as is cirrhosis in many cases. So most people never have symptoms of cirrhosis until they're in liver failure or cancer, because usually cancer starts as a small area and then it grows over time. And so it's that growth of a very large tumor that may give you symptoms, but there really aren't symptoms per se of liver cancer until it's quite advanced. So it's important to know that the symptoms that people do present with are usually vague. They could be abdominal pain, weight loss, signs of liver failure, but we still have to kind of figure out what's really going on with that patient who presents with symptoms. And more often than not, liver cirrhosis and liver cancer are diagnosed in the asymptomatic patient.
Okay. And also to clarify further, cirrhosis does not always lead to cancer. Is that true?
Oh, absolutely not. Yeah. So it's a risk factor. And depending upon the cause of cirrhosis, the risk of cancer may be higher. So not everybody with cirrhosis will get liver cancer, but everybody with cirrhosis is at risk of developing liver cancer more so than the background population, much more so, which is why they should be in a screening program.
Okay, all right. And so as you said, there's very often asymptomatic. So there are no signs of just liver disease in general, and then therefore there may not be any signs of liver cancer. So how is liver disease diagnosed? And then more specifically, how do we arrive at the diagnosis of cancer, especially because it's kind of tricky?
Right. So liver disease really has to be suspected. And this is a big problem because primary care is usually the first type of provider that a patient would see or a person would see with any kind of problem. And that primary care provider needs to think about potential risk. Does that person engage in behaviors, for example, that could cause a risk to their liver for the development of cirrhosis over time? And then any abnormal findings on physical exam, and these can be subtle, okay? Any abnormal findings on imaging or blood tests, all of those things, sort of the constellation of these things taken together can lead a person to suspect cirrhosis. But that means that you need to see your provider regularly, and this is an issue, right? People, if you are, developing liver disease and even liver cancer without symptoms, how are you going to know unless you're in regular care? And I think that really harkens back to the whole notion of preventive medicine. A lot of a doctor's time is spent putting out fires, and those fires could have easily been prevented. And that requires you taking ownership of your health and making sure that you are being seen regularly. And that you are engaging in a healthy lifestyle, and that if you're not engaging in a healthy lifestyle, you talk to somebody about it. So seeing a provider with regularity will, of course, help that provider to see the cues that may, suggest liver disease. Rarely, people will notice some changes in their own health, like loss of muscle mass. They'll see that they're really starting to lose muscles, especially in the shoulders and the legs. They might develop swelling in the legs and a protuberant abdomen with accumulation of fluid over time. That's a condition called ascites. People with liver disease can develop confusion or so-called brain fog, where the liver is unable to metabolize certain toxins and they can build up in the bloodstream and cause confusion. GI bleeding is another symptom of advanced liver disease. And so is jaundice, or yellowing of the whites of the eyes or skin. But these are usually findings of very late stage liver disease. And so the diagnosis of cancer is usually made on screening with an ultrasound, because most people with cirrhosis don't really know. You would never know that they had cirrhosis to look at them, right? So their provider suspects it, they go down a diagnostic, cascade, they get the diagnosis, and then they're entered into a liver cancer screening program, and the cancer is found on screening. That's a perfect world, right? We hope everybody would be suspected of having cirrhosis, entered into a diagnostic, testing, told, yes, indeed, you do have cirrhosis, and then you need to have liver cancer screening. However, in the real world, it's more that liver cancer is diagnosed on imaging for another indication, or more rarely when people present with symptoms.
Okay. So found by accident in a lot of cases. I know there are so many fascinating aspects of the liver, and one of them is that there are no nerve endings, and that's what in many cases prevents a person from knowing that there's anything wrong, right? Because, another part of our body, pain is an indication of something wrong. But when the liver doesn't do that, then we have no way of knowing, and that's when screening is important, right?
Right. And I think it's really, there's this, often my patients will say to me, well, I don't feel it.
Right.
I don't feel sick and I don't feel this cancer and I don't believe it, I have it, right?
Yeah.
And people can get very sick and not feel it. In fact, a lot of people have very, very high blood pressure that would give them a stroke, for example.
Yeah.
And they may not feel the symptoms of that blood pressure until they are having a stroke, right? So it's analogous to that.
Right. Yeah. And by screening, we tell people that means you go look for it, because that'll be the way to know. So we use the simple phrase liver cancer, but now there are different types of liver cancers. Can you just say a word about what some of those might be?
Sure. So the liver itself is composed of many different types of cells, and tumors can arise from these different cell types. Okay. So most commonly, liver cancer arises from the liver cells, which are called hepatocytes. And that's why we call this cancer hepatocellular carcinoma. It's a mouthful. Or HCC, because it's too much of a mouthful. Less frequently, cancer can arise from the biliary cells, and those are called cholangiocytes. And we call this cholangiocarcinoma or bile duct cancer, which is easier. So there are really two major primary types of liver cancer, but there are some very rare liver cancers that arise from other cell types, but these two are the big ones. And hepatocellular carcinoma is by far much more common than cholangiocarcinoma.
Okay. And so I'm guessing that since there are different types of liver cancers, there are different approaches to diagnosis and treatment.
Yes. So they're treated differently depending upon the stage at which they're diagnosed. Surgical cure is, of course, what everybody wants to think about up front. Could this person have a surgery where we take out the tumor? And both of those cancers, if that's feasible, that's the way to go. However, they have very different treatment pathways if the disease is more advanced. And it's very important to distinguish one from the other.
Okay. And so the questions immediately for the doctors would be, what kind of liver cancer do I have? And then take it from there.
Absolutely.
Okay. So you kind of touched on this a little bit. Are the goals of treatment always cure? Or do goals include perhaps trying to get to the point of remission, or simply stopping the progression, or quality of life? Like what is the goal of treatment?
So I think the goal of treatment is to meet the patient where they are in stage of cancer, where they are in underlying liver disease, where they are in their life, where they are in their anxiety of having heard the diagnosis of cancer. So in a perfect world, the goal of treatment is always cure. But the options for each individual are entirely dependent on all of these things. And I think it's important, it's not just the stage of the cancer diagnosis, it might be the size and number of the tumors, their location, obviously sort of big game changers like whether the tumor has spread to the blood vessels in the liver or outside the liver. These really change the way we approach the tumor. But treatment options, very importantly, also depend upon the underlying health of the liver. So even if a tumor could be at a curative stage, if the liver isn't functioning well, curative treatment may not be feasible. And that's really why you need many specialists to come together to come up with a proper individualized plan. And that usually includes liver specialists called hepatologists, surgeons, cancer specialists or oncologists, radiologists, interventional radiologists who deliver a lot of the local therapies for this cancer, and pathologists who read biopsies and that type of thing. But apart from all the specialists who sort of have all the, they're so concerned with the data on the tumor and the patient and their, blood tests and imaging and all of that, you really need a whole supportive group around each patient. And that includes palliative care, care coordination, social work. These are all essential players to really ensure that the patient is cared for holistically and comprehensively. So ultimately, we want to do what's best for each patient, and that has to be according to their unique circumstances. And after all, the patient really is the most valuable player on the team. So even though we hear a lot about precision medicine and genetic profiling, and those are very, very important to identify, targets for treatment. But I actually think of precision medicine as one step further, and that's really developing a precise plan for each individual according not just to their images, blood tests, physical exam, even genes, but to their circumstances and to their family.
So team is so important in somebody's healthcare. I know sometimes people get a little frustrated. Oh, I'm seeing so many doctors, but that's the point. That's what we want them to do, right? Because
Exactly.
It's such a, there's so much going on that we want each of those specialties. So people shouldn't, get frustrated. I know I say shouldn't, but we hope a person would not get frustrated by seeing a number of different physicians or a number of different types of testing, because it's all important, right, to come together.
Absolutely.
People also will contact our helpline. I refer to the helpline a lot because it's one of the areas at the Liver Foundation that I oversee. And some of the people who contact us are concerned about the time it takes to see a specialist. Or they're told, okay, we'll begin treatment like in a few weeks. I think it's a part of human nature that if we know something is wrong with us, especially our health, we want it taken care of immediately. We want, whether it's a procedure or something, like do it tomorrow or even later today if we can. From your point of view as a physician, what can you say about this element of time when it comes to liver cancer and its progression, and how people's concerns can be allayed if there's a little bit of time between seeing a physician or treatment starting?
So that's an excellent question. I mean, in general, the growth of liver cancer is measurable in months. And usually the doubling time of a cancer, so say you have a 1 centimeter mass, the doubling time of that cancer is usually somewhere around 3 to 6 months. But it's complex, and there's a lot of heterogeneity to every cancer, not just liver cancer, in terms of aggressiveness and that kind of thing. So, but having said that, we also need to gather data, right? So for you to get a decent and comprehensive plan for your liver cancer, we need to gather imaging, blood work, physical findings, a comprehensive medical history. And, there's usually somebody driving that, developing sort of a repository for all that information and then presenting it. And that can sometimes take time, especially if you haven't gotten all of your healthcare in one setting, for example. Like, say you went to an ER with some pain, you got imaging, then you went to your local doc and they sent you to a different hospital for a biopsy. Well, somebody has to gather all that information together. So I would say that from the definitive diagnosis of a liver cancer, treatment should be well on its way as early as possible in the best of circumstances, obviously, but most often within 4 to 6 weeks.
Okay. In general, I mentioned before that one of the unique aspects of the liver is no nerve endings. Another unique aspect of the liver is that healing and regenerative nature of the organ. And so basically, like the liver is always trying to be healthy, right? And so that plays a role in the time or the progression of liver disease in regard to time, right? Is that why liver disease progresses slowly? Because the organ's always trying to stay as healthy as it can?
Yes and no. That's a very complicated question. Once a person has cirrhosis, the organ doesn't regenerate properly.
Okay.
And that's a major issue. And so I would say that the progression of liver cancer, although we have these studies that show this doubling time of somewhere between 3 to 6 months, we also know that the larger a tumor gets, the more likely it is to take on mutations that make it more aggressive, because it's gone through steps to enlarge itself. And as you go through those steps, you lose a lot of regulatory control over a cell, and a cell can take on pretty aggressive characteristics. So the larger, the more aggressive. The other thing is that if it's multifocal, and a lot of liver cancer is, it's not just one spot, but it's multiple spots, that also would portend a poorer prognosis. So it's so individual according to, size, number of lesions, et cetera, that I think the regenerative part, you're almost sort of, the cat's out of the bag when you have cirrhosis. You really have changed the architecture of your liver so much so that repair is elusive.
Okay. So now going, let's say, a step beyond treatment, or maybe along with treatment, are clinical trials. Can you just say something about what's the current status of clinical trials for liver cancer? And when you speak with your own patients about clinical trials, like when do you bring that up, or what is the context of that discussion that you have?
That's a great question. So there are many clinical trials ongoing for liver cancer. And in fact, any patient can look up what's out there. And you can do this by going to clinicaltrials.gov, which is a public website, which every clinical trial is required to actually post their trial on this website, especially if they're funded by government sources. But mostly people do it regardless of funding because they want to recruit people to their trials. I stay informed about trials through certain networks, but also by looking at what's on this site. And, we've seen tremendous advances in liver cancer therapeutics, and that's really because of the investigators who are willing to think about these trials and do the hard work to really open these trials, but also the patients who agree to enroll in trials. And, these are volunteers. And we really owe them a huge debt of gratitude for volunteering. And really, the trials are an experimental regimen or an experimental intervention. They're not all drug trials against a standard of care. And the patient usually has a 50-50 chance of receiving the experimental regimen or the standard of care. And just a brief search of liver cancer in clinicaltrials.gov, you'll see there's over 3,000 trials. And then you can search by which trials are actively recruiting, which trials are in your area. If you're interested in a particular drug, you can even put that as a keyword. So there's a lot you can do with that search engine. And you can do this online. But I would say that dealing with the diagnosis of cancer is pretty difficult and overwhelming. So a lot of patients won't do this on their own. They really have to be, guided by their provider, and they really have to be counseled by their provider by simply asking the question, should I be considering clinical trials? And is there a good trial for me? I can tell you that most liver cancer is and should always be dealt with in the confines of a tumor board where people come together to talk about the patient from all kinds of disciplines. And one of the subjects is clinical trials. And in fact, it's for, in my institution, it's templated in the note, were clinical trials discussed for this patient, yes or no? And if so, what trial? So I discuss clinical trials with all of my patients when I see them and throughout the course of their care. Some of these trials that are of particular interest to me are of course drug trials, but there's also a lot of patient-reported outcomes type trials and quality of life, health-related quality of life type trials. One that I'm participating in now that really hopes to understand the patient perspective. So I think depending upon people always say, well, I don't really want to try anything experimental. And that could be fine in a setting of a drug, for example. Maybe you don't want to try an experimental drug, you want to be on the standard of care, but you can actually contribute your experience to the greater good. And sometimes people find that very comforting. And it's almost, in a way, a legacy, to say that I participated in this trial and I gave my opinion about the things that matter most to me so that could be a benefit for other people who develop this disease.
Right. And that's important information. You mentioned a person's medical team, but also their own personal support staff. I almost said staff, but support group, right? That would be family members, loved ones who can, because it is so overwhelming, just to know that you're dealing with cancer, but to have those others perhaps who can, speak a little bit more specifically about this and explain why something might be, the right for that person, or perhaps if something is not. So
Right.
it's a very important discussion on many levels.
I agree.
Yeah. Well, thank you very much for answering our questions. Now, I have never been, and ALF has never been in short supply of self-promotion. So I'm going to say that, or make known that we have our second liver cancer conference for patients and for caregivers. That's coming up October 15th and 16th. And as I mentioned in our intro, you're a member of the planning committee. So thank you, of course, on behalf of all of us for that. Why do you think this, and we always say free, why do you feel this free conference would be beneficial to people and who either have liver disease, a loved one has it, or who just, might be something that might be of interest to them for various reasons? So how do you view this conference coming up, and what would be the benefits of folks joining in?
So, the first conference received really great reviews, and it was, anytime you do something the first time, you're nervous, will patients like this? Will we really put it in terms that resonate with the patient? And we're also used to giving talks to peers and our colleagues. It's tough to kind of regroup and say, I really want to give this talk to the patient. And so we've tried to make it extremely accessible to patients so that they can ask questions. It's very interactive. We try to really, not have so many slides and talk about scientific pathways and things like that, which are important. But I think to this audience is, really the practical nuts and bolts of what is liver cancer, how is it managed, how should you advocate for yourself? And you really bring an all-star team of people to this conference that really have tremendous experience in managing liver cancer, and also on the experimental side and knowing what's coming down the pike, which of course can give tremendous hope to people who are suffering. So I think those things are very important. This conference touches on all of the things we discussed today, but in much greater detail, including available treatments, navigating clinical trials, nutrition, mindfulness, and really coping with cancer. So it's been an honor to be part of the planning committee, and I really look forward to this next conference. And I think it's really important for, it's for patients and caregivers. And the more you know, the more you can advocate. And that's really important, not just for patients, but also for caregivers. Patients get exhausted by the burden of their disease and just managing, their appointments, coping with the stress. And so for another set of ears to be there, a caregiver, a friend, to really help to synthesize the information, put it in a way after that appointment where, they can really talk about it and figure out what's best. And so this conference is really geared not just to the patient, but also to the caregiver. And we hope that it spurs many conversations, after the 2-day conference is over. Yeah. So it's, it was fantastic last year. I'm really looking forward to it this year.
Yes, as we are. And we always tell people that knowledge is power, right? So the more a person understands something about their own medical condition, what we have found since education is one of the mission pillars of ALF is that what it does is it kind of changes the game on the thinking of a patient who says, it's no longer something being done to me. It's something that we're discussing together. So I'm part of the discussion because I have the knowledge, and if I don't have it, my loved one or my caregiver does. So that information is so important in that dynamic, I think, of how someone can approach their disease and the treatments that they're going to be facing, as a part of that. So again, thank you so much for your participation in that.
My pleasure.
And thank you for on behalf of all of us and for those folks who are going to be viewing this this segment of our series online. I want to thank you for your time and your expertise. as we highlight, a very important issue of liver cancer and what people can do for their liver health. Because as we talked about, screening and prevention can translate into overall health as well. So for more information on liver disease and liver wellness, we invite everyone to go to our website, which is www.liverfoundation.org. And you can check out our YouTube channel for more informative videos such as this one about all aspects of liver disease and wellness. And most specifically today, we ask you to go into and to consider joining us in October for our liver cancer conference. So we'll see you all next time with a brand new episode of the ALF Liver Chat series.
Thank you, Warren.
Thank you.